Hi, today I'm going to talk about high blood pressure, why it's important, why it occurs, and I'm going to give you a superfood that will help you lower it. My name is Dr. Baritz. I'm a chiropractor, nutritionist, and herbalist. My purpose is to help people live better naturally, and I provide natural solutions for common health problems. In my clinic, I've helped tens of thousands of people, and I would like to help you too. High blood pressure increases your risk for heart disease and stroke, which are the leading causes of death in the United States. About 1,100 Americans die every day as a direct result of high blood pressure, and many more have their lives ruined. Your heart, arteries, and veins make up a plumbing system that delivers blood to the tissues and organs in your body. And just like any other plumbing system, it is rated for a certain amount of pressure. Too much pressure in the system for too long can cause weak spots and blowouts. High blood pressure can affect your brain, leading to a decreased ability to think clearly. It can affect your eyes, causing vision problems, and your kidneys, leading to kidney disease. Often high blood pressure has no obvious symptoms, and about 20% of those with high blood pressure don't even know they have it. About a third of all American adults have high blood pressure, and another third of Americans have pre-hypertension. That is blood pressure that is higher than normal, but not yet in the high blood pressure range. Only about 50% of those people taking medications are able to lower their blood pressure to the recommended levels. Medical professionals claim that there is no known cause for 95% of all the cases of high blood pressure. They even have a special name for it. They call it idiopathic hypertension. Sometimes they call it primary hypertension, and it's sometimes called essential hypertension. But whatever they call it, it means the same thing. A condition that arises spontaneously or for which the cause is unknown. We do know that blood pressure is absolutely necessary for life. It pumps blood through your body to bring nutrients and oxygen to your tissues and organs. We know that your body constantly monitors and adjusts your blood pressure to adapt to various conditions. For example, your blood pressure goes down when you're sleeping, and it will go up if you're running. We know that your body was born with an innate ability to monitor and control your blood pressure. So why is it that some people have high blood pressure? After millions of years of development, did nature or God get it wrong and put a time bomb in the human body? Did, for no known reason, the internal control mechanism of 1/3 of all American adults suddenly malfunction, rendering them at a higher risk for a heart attack or a stroke? I don't think so. So what is the cause of high blood pressure? Actually, every 10-year-old knows the cause of high blood pressure, and so do you. Put your thumb on the end of a garden hose and notice the increase in water pressure. Just like in the garden hose example, your body increases blood pressure to compensate for increased resistance along the flow of blood. That's it. That's it. The cause of high blood pressure is increased resistance to the flow of blood. The mystery of idiopathic hypertension has been solved. So we can direct our attention to resolving the known causes of high blood pressure. There are several natural methods to lower your blood pressure by decreasing resistance to blood flow, and I will cover them in future videos. In this video, I will focus on the health benefits of beets. Numerous studies have shown that the nitrates in beets and other vegetables can significantly lower blood pressure. In one study, a beet drink reduced systolic blood pressure by approximately 10 points, with the greatest drop occurring 3 to 6 hours after consumption. In this study, the blood pressure lowering effect lasted for at least 24 hours. Another study showed that modest reductions in blood pressure, like the 10 points I just mentioned, reduced the risk of heart attacks by 22% and strokes by a whopping 41% over a 5-year period. It is believed that the nitrates in beets promote the formation of nitrous oxide, which dilates your blood vessels, increasing blood flow. It also reduces the stickiness of platelets and vascular inflammation. It is these mechanisms which may help lower blood pressure and improve the function of erectile tissue in men and women. Lower blood pressure and better sex? This you have to try. Drinking beets might help you live longer, and you'll be happier you did. Studies also show that increasing nitrous oxide production can help reduce muscle soreness, boost athletic performance, and help manage blood sugar levels. Other vegetables known to be high in nitrates are celery, kale, radish, and spinach. Most commercial beet juices are full of sugar, so I like to have steamed beets sliced in my salad, or even better, raw beets in a smoothie. Here is a smoothie recipe that I like. You can find a lot more online. You will need 1 large beet, steamed or raw, 2 stalks of celery, a half a cup of frozen blueberries, a handful of organic spinach, 2 ounces of lemon juice, a tablespoon of stevia, monk fruit, or truvia, a half cup of water, a cup of ice cubes, and a 1 inch of fresh ginger root. You also need a high-powered blender like a Vitamix or a Ninja. Here are the directions. 1. Peel the beet and ginger root. 2. Roughly chop the beet, celery, and ginger root. Put all the ingredients in a blender and mix until smooth. Then, taste the smoothie and see if it's to your liking. Feel free to add more stevia if you want something a little sweeter. Usually you serve immediately. You can serve the smoothie in a jar for up to 2 days. Ingredients tend to settle, so shake before using. I'm going to try a glass right now. That's delicious. If you don't see your blood pressure lowering after 2 weeks, increase to 2 glasses a day, and if necessary, try 3 glasses a day. Beets may turn your urine red, which shows that they're getting into your system. In this video, I explained that high blood pressure is a common problem affecting 1 in every 3 adults in the U.S. and is responsible for the deaths of over 1,000 Americans every day. While mainstream medicine continues to perpetuate the myth that the cause of high blood pressure is unknown, I have revealed to you that your body purposefully increases your blood pressure in response to resistance to the flow of blood. The holistic approach to high blood pressure is to improve the flow of blood in your body. In this video, I discuss the use of beets to reduce the resistance to blood flow. In other videos, I will give you other natural approaches to reduce the resistance to blood flow and lower your blood pressure. Thank you for watching. If you have a natural remedy for blood pressure, please note it below in the comments. If you want to give this a try, please write the word beets below in the comments. If you like this video, please give me a thumbs up. And don't forget to hit the subscribe button and notify bell icon to get more videos like this one. Here are some beets to your health. I do see a couple of questions coming up. I'm going to cover the questions all in the end because we actually have a bit more information to go through. This is the front page of the brochure that is part of your handouts. And you can see there's a click for the acupuncture point video, which we'll see in just a minute. And there's a click for the video that you just watched. Now, if you're interested, for anyone who's online with the webinar, I will create a custom version for you. I'll put your name, your office information, and your website with a clickable link right over here. Just email me and I'll do that for you. Let's take a quick look what's in here, and then we'll get into the supplements. So this is the acupuncture point location page, telling patients anterior, posterior, directional terms, how to do the measurements. These are the points. We'll cover those in detail in just a minute. Here are the standard process products. We'll cover those in detail in just a minute. But you can see Cardio Plus, for example, 4 twice a day. You see a 1-3. Come down here, 1, it's a standard process product, and 2, take on an empty stomach. Over here is the medical disclaimer.
Okay, so let's take a look at the products. The first one is Beet. Hey, those drinks are great, but maybe some patients don't have the time or the equipment or the patience to make a drink. So what the geniuses at Standard Process did is they made it into these little tablets. And the dose is 3 tablets 2 or 3 times a day. So you start with 3 tablets twice a day, and if necessary, you can increase to 3 times a day after a week or so. So that supports natural detox, contains betaine, and basically it's great for anyone who has a gallbladder or a fatty liver or any congestion in the liver. Congestion in the liver increases the pressure of blood flow. And so when you decongest the liver, there's less pressure against the flow of blood. Next product is Cardio Plus, the famous product created by Dr. Roy Lee as a one-stop shop for patients with normal or high blood pressure. Doses 4 twice a day on an empty stomach. Supports healthy heart function, supports healthy coronary blood flow, antioxidant activity, supports increased oxygen during exercise, contains these products here. Cataplex G increases the diameter of the artery, reducing the resistance to blood flow. Cataplex E2 increases the diameter of the coronary arteries, reducing the resistance to blood flow. Phosphate liquid. This does encourage a normal blood calcium ratio, and it helps reabsorb calcium in the joints, and it's believed to help reduce blood pressure because it reduces calcium deposits in the arteries, opening the flow, reducing the need for higher blood pressures. Drenamine, 4 twice a day on an empty stomach. The fight or flight reaction of the autonomic nervous system increases the diameter of the artery, decreases the diameter of the arteries to force blood to the muscles. But this increases your blood pressure. So Drenamine turns down the fight or flight reaction so your body can then go back to the normal diameter of the artery, of course, reducing resistance to blood flow. Next is Min-Chex, doses 3 twice a day. Supports the nervous system. Min-Chex is a moderate calmative that maintains emotional balance. Well, when people get upset, they get angry and their arteries start to bulge. That's because the autonomic nervous system is decreasing the size of the artery. Min-Chex turns this down so the arteries increase, the resistance against blood flow is decreased. Hawthorn. All right. Hawthorn is the herb for the heart. The Germans call it the nurse of the elderly heart. It's effective for high blood pressure, but it's slow to act, taking 1 to 2 months to bring blood pressure down. So, don't worry about it. This is a little bit of a long haul product. Just let the patient know it's going to take a little time before you have measurable results. But let me tell you this, based on my own personal experience in my clinic, if you, a patient or a loved one, has any heart issue or has a family history of any heart issue or is interested in keeping their heart healthy, they should be taking Hawthorn. It's part of my daily program, and it should be part of yours. Start with 2 twice a day, and after some months, you may reduce to 1 twice a day. Okay, so that's the basic protocol, and it's all in the handout. Also consider Antranex. Antranex works to reduce the effect of allergies. Allergies, like any other insult to the body, decreases the caliber of the blood flow. If you want to test it, this is the testing protocol. It takes about an hour and a half. Take a person's blood pressure, have them chew 3 Antranex. Check their blood pressure every 15 minutes. After 1 hour, that's 12 Antranex, retake the blood pressure. A drop of 10 points on on either of the blood pressure numbers is a positive. And the patient can continue to check their blood pressure for the next 24 hours. It may take effect at that period of time. So this is the test. Test it. If it works, Antranex is part of the program. If it doesn't, you just move on. Okay, Orchex. This is a potent calmative to help maintain emotional balance. This is an alternative to Minchex for the person who's about to blow their stack. You know the type I'm talking about. It's also great for women with menopausal or postmenopausal hypertension. Okay, Rena food, twice a day on an empty stomach. If a person has kidney problems or if they're a diabetic, their kidneys are they're predisposed to kidney damage, and the blood pressure can cause kidney damage. If they have predispositions, they should be on Rena food to protect their kidneys. Okay, Liverplex. If they have a history of hepatitis, if they have a history of alcoholism, or if you notice high liver enzymes on their blood test, then they need Liverplex to protect their liver from the effects of high blood pressure. Okay, so now let's go on to, and I'll answer any questions when we're through, but let's take a look at the acupuncture points at this video here.
Hello. In the next few minutes, I'm going to show you how to locate and activate 3 research-tested acupuncture points to lower your blood pressure. High blood pressure is a major risk factor for heart attacks and stroke. High blood pressure can also damage the kidneys and other organs. In some cases, people with high blood pressure have a pounding feeling in their head or chest. Others have a feeling of lightheadedness, dizziness, or experience unusual uterine bleeding. But most of the time, high blood pressure has no symptoms at all. Now, people with known high blood pressure are usually offered medications. While modern high blood pressure medications are effective, they can produce undesirable side effects including headaches, depression, trouble sleeping, weakness, and joint pain. And many men stop their high blood pressure medications when they discover that it causes ED. Here are 3 facts about high blood pressure from the CDC. 1. Having high blood pressure puts you at risk for heart disease and stroke. 2. Nearly half of all the adults in the U.S. have high blood pressure. And 3. Of those with high blood pressure, only 24%, or about a quarter of them, have it under control. With more people being affected by high blood pressure each year, the need for a safe, natural, and effective method to reduce blood pressure has never been greater. Fortunately, a slew of studies have demonstrated that acupuncture can lower blood pressure. Studies show that acupuncture may lower blood pressure for those taking medications and those who are not yet taking medications. And as someone who has had high blood pressure, I'm thrilled to bring this information to you. In the next few minutes, I will show you how to locate and activate 3 acupuncture points to lower your blood pressure. Used individually, each of these points can lower your blood pressure, but when you put them together, the results are much better. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The first point I'm going to introduce today is liver 3. Liver 3 is known as the important pass, signifying the high level of vital energy that passes through this point. In addition to helping lower blood pressure, liver 3 is traditionally used to help with menstrual problems, gallstones, urinary incontinence, and the physical discomforts related to stress. Liver 3 has been used for over 1,000 years to relieve epileptic seizures, which points to its powerful effect on the nervous system. Liver 3 is located at the top of your foot. To locate liver 3, place your finger between your great toe and the toe next to it. Then move your finger towards your ankle till you're on top of your foot. Notice that your finger is between 2 bones. Staying in that groove, move your finger towards your leg till those bones seem to come together. Press into that location and find a tender spot. That is liver 3. Stimulate it 5 times rapidly with your finger or the spring end of a Tai Shin. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tai Shin, it might look like this. Now find liver 3 on your other foot and repeat. During or shortly after stimulating liver 3, you may notice a sensation of heat or energy in your foot, leg, or pelvis. This is normal and therapeutic. Kidney 3 is the next point recommended to lower blood pressure. In addition to helping lower blood pressure, this amazing point is used to help with dizziness, ED, and to improve reaction time. Kidney 3 has also been used to help with hearing, frequent urination, asthma, and to strengthen the lower back. Kidney 3 is located on the inside of the leg between the ankle bone and the back of the leg. To locate kidney 3 on the inside of your leg, put your finger on the tip of your ankle bone, then move it towards the back of your leg. When your finger comes off the bone, it will be in a depression between the ankle and the back of the leg. Push in there to find a spot that is tender, sore, or sensitive. That is kidney 3. Stimulate it 5 times rapidly. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find kidney 3 on your other leg and repeat. After activating kidney 3, take a few deep breaths. You might just feel a fuller breath. And some people notice a sensation of heat or energy in their chest, throat, or pelvis. Chronic stress can be a contributing factor to high blood pressure. That is why stress-relieving herbs are traditionally recommended for those with high blood pressure. Large intestine 11 completes this powerful trio. Large intestine 11 is a major acupuncture point used to address a long list of conditions related to inflammation, like itching, numbness, seasonal allergies, food allergies, constipation, and any type of skin condition, as well as high cholesterol and, of course, high blood pressure. To locate large intestine 11, bend your elbow to 90 degrees. Large intestine 11 is found on the outside of the arm, halfway between the center of the elbow crease and the tip of your elbow. Press into this area and find a spot that is a bit sore or sensitive. That is large intestine 11. You may have to check slightly higher, slightly lower, or off to one side. Stimulate the point by rubbing it 5 times quickly, then take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find large intestine 11 on your other arm and repeat. If you have high blood pressure, I suggest you use these points 3 times a day for 30 days for fast results, then twice a day for the next 90 days to continue the progress and stabilize results. And be sure to check out my other videos for more natural remedies on high blood pressure. I put links below for those videos. If you or a loved one has high blood pressure, it's my wish that these videos will help you have a healthier and happier life.
Well, that completes the video presentation. So I do have a few minutes now to answer any questions.
How big a glass of the Beet smoothie?
8 ounces.
Okay. The second one says, how many supplements do you typically use for high blood pressure?
I use the protocol that I showed.
Yeah, maybe. I think what they mean is when you're using those supplements for high blood pressure, how many do you use? Like, in other words, you had Cardio Plus, you had Beta Food, you had, those things, but I think they mean how many, like 15
I
Cardio
recommend you
Plus.
use the full basic protocol. And then you check for the additionals. So I can just go back here.
Yep.
Okay, so this up top here is the Beta Food, Cardio Plus, Phospholipidogrel, Minchex, Hawthorne. That's the basic protocol. Those are the doses.
Perfect. Can you just leave that up for a moment? But they have these notes. They have these notes.
Yeah,
right?
they have this. But I want to tell you something, Ben. I had this patient who came in, and we were working on ED with him. And I think I said, well, Tribulus, I forget what I dosed him. It was 4 twice
Yeah.
a day or something. And he took a look at the price of the bottle, and we kind of worked it out. I said, okay, why don't you just start with 1 twice a day? I figured I'd be kind to him, right? The
Yeah.
problem is, after 2 months, he comes back, says it didn't help. It was a waste of money. I don't think I was kind to him, and I wasn't kind to myself. I should have just said, that's it. Whatever it was 4 twice a day. He should have I should have given him if I had it to do again, I would have given him the full protocol, damn the cost, damn the amount of supplements to take, and let him make his decision. Why should I offer a protocol that's less than what I think he needs just because he doesn't want to take a lot of tablets? That's on him. What's on me and my friends in this workshop is, this is what I recommend. You can't afford it, or you don't want to take the tablets, that's totally up to you. And you can certainly do less, but if you want to get the best results, this is what I recommend. So anyhow, I just wanted to add that as a quick aside, if anyone has any concern about offering quote unquote too many products.
A question, just to follow up with this, the top 1, 2, 3, 4, 5, 6 you have listed there, the question is, do you start them all at the same time?
Yes.
Yeah. Great. Okay, here's a good one. I think you can handle this. How do you suggest the patient lower their blood pressure medication, as I cannot do that with my license?
Absolutely. I can't do it.
Patients are afraid to get off because the doctor threatens them that they need it, or they'll be in big trouble.
Absolutely. I totally understand. And this is really a common issue faced by, me and all my other colleagues, holistic health colleagues. So I always do it in coordination with their PCP. So I'm like so upfront. I said, look, so the basic thing to do is to get them started on the program and the acupuncture points. And also they should be checking their blood pressure and recording it, every day. And you will, if it's working, you will notice the blood pressure moving down, because the medication doesn't generally 100% do it. But so you give it a month or two till the blood pressure has moved down, or longer, or until you're comfortable the blood pressure is stabilized at a normal level. Then you say, great, what I suggest is you go back to your medical doctor. You don't have to tell them all these supplements you're taking. You can just say, look, I've improved my life. I'm exercising. I've got a better lifestyle. I'm eating better. And I'd like to attempt to come off or reduce my blood pressure medication. Most physicians are only too happy to support the patient who has that kind of attitude. And what they'll do is they'll say, great, well, why don't you're taking 3 medications? Why don't we cut down 1? Or why don't we reduce the dose? But that's his job to do. And then he makes his reduction. Then you work with the patient. Maybe you're going to add some more supplements. Maybe you're going to add some more acupuncture points. And then 2-3 months later, the blood pressure is still moving down or in normal range. Then they go back to the PCP. Hey, that worked great. And then they work their way down until they're either off the medication or they reach the base level at which, when they try to go off it, the blood pressure goes back up. So that's been a very successful way to work with medical doctors. I hope that answers the question.
Yeah, that's great. I get this a lot too, because we're doing so many different programs with so many different patients, and I'll get this question from the practitioner. I'll just add, very often the practitioner themselves, the prescribing physician will say, wow, the medicine's really working. We can lower the amount we have you on. I'm not kidding. Synthroid, whatever it is, they're often saying, we have titrophin, and they say, wow, this medication's really fixing you. We can lower it. So yeah. There's a comment here, and if anyone else has any more questions, please type them in the chat box. Right, because we don't. We also. I'm sorry. There is a Q&A box also if you prefer to use that. There's a comment here. It says the Beet smoothie is also great to drink when the trick-or-treaters come to the door and you're wearing your fake Dracula teeth.
Yeah, great idea.
All right. It's very seasonal. I'm glad you, and for parties too, of course. Okay, well, that's it in the chat. Here we go. Oh, okay. Good. Fake Dracula teeth, right. Do you steam the beets or do you do it raw?
Sometimes I steam and sometimes I do it raw. It's really just luck of the draw, what I feel like doing.
Great.
But it's harder to blend a raw beet. I mean, a raw beet is hard.
Yeah, you need a real, like, what do they call it? Those blenders, those high-powered blenders.
Yeah. But also
Vitamix.
you can go to the you can actually so it's probably smarter just to at least lightly steam it to begin to break down the connective tissue.
Yeah, like a Vitamix would handle it, but yes.
Yeah.
Great. Any other questions or comments? Okay. Vitamix is on sale at QVC. All right. This is off topic. Someone does have a question for you. If you want to answer it, it's up to you.
I'm on day
Might be
4
out
of a bad case of the flu. Any acupuncture points to help me with the symptoms? Yes, actually, give me a second here to look that up for you.
While he's doing that, I'll just mention serum calcium, serum calcium, serum calcium. Dr. Lee wrote about that extensively, as did Mark Anderson. They were talking about the influenza epidemic 1919. The triad of health, Cataplex F, Cataplex C, calcium lactate.
So the point, and I have a video on this, by the way. I don't know if I can put it in the chat. I'm going to put the name of the video in the chat box. I think I can probably do that. It's called Strengthen. Oops. Strengthen immunity naturally. And the points that you're going to learn, if you're already familiar with how to find and activate the acupuncture points, are stomach 12, gallbladder 40, and conception vessel 4. I would do that protocol 3 times a day until you're feeling better.
All right, great. Well, thank you, everyone. And we will see you next week.
All right, Ben. Have a good night.
Have a great night. Thank you so much.
Bye-bye.